out on Tuesdays and Thursdays with the team, and Dr. Ryan and Nurse Nancy are assigned to the Palisades. I think we have a picture. There's Glenda and Nurse Nancy pounding the pavement. Her backpack has medical supplies in it. So we talked a little bit about our organization. We were formed in 2016 because of the merger between OPCC and LAMP Community. We have 7 core services. All of these services are available to all of your homeless neighbors in the Palisades. So part of the leverage that our agency brings to our partnership here is these are all services that the community is not paying for directly. You are paying for the outreach team, but you're not paying for all of these other services, yet all these other services are available to this community and to your homeless neighbors. And that really is critically important. So we have housing, both interim and permanent supportive housing, mental health care. We have, right at last count, we have 72 clinicians, licensed and unlicensed mental health professionals who are on our staff and who are assigned to work with our clients. Medical care, substance abuse services, income and benefits, and that is essentially for people who are able to go back to work, to assist them with that. Many of the people that we serve will live on Social Security disability income. It's very important that we get their incomes up because housing is very expensive in Los Angeles County. And so even if someone has $850 a month, believe it or not, it's not enough to pay the rent without a subsidy or in a unit that's subsidized, but it actually creates more housing opportunities for them. So getting benefits is critically important. Domestic violence services, a lot of people know that People Concerned, or OPCC, as a homeless service agency, and that we are. But actually what many people don't realize is we operate the second oldest domestic violence shelter in the state of California, Sojourn, which was founded actually in 1977, is celebrating its 40th anniversary this year. So domestic violence has been a core part of our work for many years. And then wellness and life skills, and that's a very broad phrase for everything from helping our clients establish healthier lifestyles, kind of understand their illness, how to manage symptoms, but it's not just focused on disease and illness. It's really about healthy living, helping them make the transition into permanent housing, how to live on a budget, as they transition from the streets into housing, the expectations of moving into housing and what that involves, paying their rent in full on time every month, not disturbing their neighbors, keeping their units clean. So those are our 7 core services. Here are some of our facilities. Our Access Center, and this is a shot of the Access Center. This is actually where we have a medical clinic located here, actually behind over here, the medical clinic. We have 3 rooms there, 2 exam rooms and a laboratory on site. So for any of the clients who are encountered by the outreach team can be connected to ongoing primary care here at the Access Center. This is a drop-in center. So for individuals who are able to navigate and get to the Access Center, it's open 7 days a week, and we provide basic services, food, clothing, showers, laundry facilities, as well as access to telephone if people need to make appointments or they need to make connections. We provide mail and message services, so if people are looking for employment, after your name, the next box on the application is your address so that they can actually receive mail. If they're receiving benefits or checks or any kind of mail, it's a safe delivery spot for them. And then we have longer term services, case management, which essentially is connecting people to ongoing services and interim housing as well as permanent housing. This just gives you an idea of the volume. So we love acronyms at our agency. So the shower program is called SWASHLOCK, showers, washers, lockers. Isn't that clever? I didn't think of it. It was in place when I came to the agency many years ago. Where we provide, one of the complaints that you hear a lot about homeless people is they urinate and they defecate all over the place, and yet most businesses don't open up their restrooms to the public, and so what are people supposed to do? So We provide access to restrooms and showers, and laundry facilities, and lockers for safe storage for people who are going to appointments, or they're looking for employment, or in many cases going to school. They can store their belongings safely. We have a lunch program, a grocery program for housed individuals and families in Santa Monica, and then of course our laundry and locker services. This is one of our interim housing programs, and we don't describe our housing as emergency or transitional shelter. It is interim housing because we use it as a bridge from moving from the streets into permanent housing. So our goal is to move people into permanent housing, the appropriate level of permanent housing for them, as quickly as possible. But in order to access permanent housing, you need to have certain documents and you need to have income. Those are the two primary things. So we have many people who, for instance, don't have a birth certificate, or they don't have an ID, and they don't have the required documents. And so Glenda and Mark will tell you they spend a fair amount of time getting people what we call document ready. And that is not permanent housing. We don't hold out as a reward for good behavior, but really to work with our clients on making sure that they have everything that they need to move into housing and to be successful in housing. This is a 55-bed interim housing site. So this is, speaks a little bit more to our philosophy. Our agency was founded on the concept of neighbors helping neighbors. 54 years ago, actually longer than that, before we were incorporated as a nonprofit. It was primarily for families who lived in the Ocean Park neighborhood of Santa Monica, which at that time was a very different place than it is today. And so it was neighbors who were taking care of their kids while their neighbors were going to work. And they provided after-school activities for today what we would call latch kid keys or at-risk youth. In those days, it was just kids who lived in the neighborhood who were getting into trouble after school because they didn't have anything to do. They had a food pantry. They had a jobs and housing board, so people who lived in the neighborhood who were looking for employment or housing came to the community center. That was the genesis of the Ocean Park Community Center. Today, we've become a multifaceted social service agency. As the needs of the community have changed and evolved, so have we. So Sojourn came about because volunteers who worked at the drop-in center, which was the predecessor to the Access Center, noticed that when they came in the morning, there were often women who were parked in the parking lot. Sometimes they had children, sometimes they didn't. This was in the early 1970s. There was no such thing as battered women's shelter. And they began to talk with these women. They weren't homeless. They were actually leaving their abuser and they came to the center because they knew that it was a safe space. So they would come there at night and they would sleep in their cars. And then in the morning when their batterer would leave for work, they would go back home. And that was really the beginning of Sojourn Services for battered women and their children. So we have always been an organization that has really been very close to the ground and really responsive to the needs of the people that we serve. This is a shot of Turning Point, which is another one of our interim housing programs. And for those of you that have had the opportunity to tour, and I would issue this invitation to any of you who ever want to come and see any of our programs or facilities, you are welcome to do that. We're more than happy to show you what we're doing. And by the way, everything that you see up here, we do not charge our clients for any of these services. These are all provided free of charge, so we don't want that to be a barrier for receiving services. Food is a big part of our culture, and so you see here that we provide, of course, healthy and nutritious food. And then this is my friend Felix, who is a wonderful human being and is working at a community garden. So we have a gentleman in Santa Monica who many years ago gave over his yard. This is his backyard. And so Felix is a former client, now has been in permanent housing for how many years now? Decade? 10, more than 10. I've been at the agency 18, so it's been at least half that time. And he works as a peer advocate, tending the garden. He works on site at one of our programs, but really works as a mentor to other clients. And so they grow fruits and vegetables, which then they bring to the facilities and use in cooking. This is the access center. This is the access center. This is Turning Point. So we have laundry and clothing facilities, as well as showers. And then our permanent housing and case management. I want to talk a little bit about permanence, the difference between affordable housing and permanent supportive housing. So how many of you are familiar with affordable housing? You've heard the phrase affordable housing, okay. Sometimes it's referred to as low-income housing, which isn't necessarily accurate. So affordable housing is designed and built and constructed for people where it's means tested. So it's based on income. And affordable housing can range anywhere from 30% of median income all the way up to 80% of median income, depending on the community. So in very high-cost housing areas where there's high cost of housing, the median could be 60 to 70% of the area median income would still qualify as affordable housing. So that is often housing that's used for people in the service industry, teachers, sometimes firefighters, public servants, as a way of creating affordability. And for our purposes, permanent supportive housing is affordable housing targeted at people at the very low income level. So I said earlier that many of the people we serve live on Social Security income, which is about, on average, about $850 a month. So you think about that, that's really less than $10,000 a year. So when we're looking at permanent supportive housing, we're looking at housing that generally is subsidized in some way. And so the ways that those are subsidized is usually through Section 8 or Shelter Plus Care. People are familiar with Section 8. So it's basically a rental subsidy that comes from the federal government. It flows to the local housing authority, and it pays the individual, the tenant, pays 30% of their adjusted gross income for rent, and the balance is then subsidized through this voucher subsidy. So in a simple equation, if the apartment cost $1,000 a month, and actually in Los Angeles, the average rental price is about $2,500 a month across the county. But we're seeing for most one-bedroom apartments are running between $1,600 and $1,800 a month. So if someone had $850 a month in income, they pay 30% of that towards the rent, and the balance, the difference between that 30% and the $1,600 or $1,800 would be paid through the voucher or subsidy. One of the biggest challenges we have when we see the explosion of homelessness around the county is the issue of housing. Housing affordability generally, not just for homeless people, but for working people. We have been digging a hole deeper and deeper and deeper for decades, and now really we have reaped what we have sown, unfortunately. So we're going to need, and we're going to talk about Measure H and HHH a little bit later, in terms of how we're trying to dig ourselves out of that hole. But that gives you a little bit of perspective. And one of the challenges that many of our clients face, because they get that voucher, which is like the holy grail of housing, right? You feel like you've arrived when you got your voucher, and it can be a very frustrating experience because they're out pounding the pavement and they can't find units that are available. In a very perverse way, when the economy is good and the rental market in Los Angeles at all income levels, so not just very low income, but all vacancy rates is at less than 3% in the county of Los Angeles. So think about that. You think about the west side, where you have very high incomes and high rents, and our clients who have $10,000 a year, even with a voucher subsidy, are competing against people for available units who are making far more money in the tech sector or in the entertainment industry, and they're competing. So you have a landlord who says, well, if I could rent my unit for $2,500 to this person, or I can take a voucher subsidy and take less money, when I know there's a lot of demand for my unit, which one am I going to take? And so in a very perverse way, when the economy is bad, during recessionary times, we actually find that housing availability for our clients goes up, because there's an inverse relationship, right? That the landlords are more willing to take the voucher subsidies because it provides a guaranteed income for them. Unfortunately, we haven't been, well, fortunately and unfortunately, fortunately for the general population, the Great Recession of 2008 is behind us, but for our clients, they're continuing to struggle with this affordability gap. collapse. So that is a really critical issue that we'll come back to in a little bit. This is something that I crow loud and long about, because this is something that we work very hard on. It's not just about housing first, it's about housing always. As I said to you earlier in the presentation, it's important for us to make sure that people, once they're in housing, that they stay housed. I've been at the agency 18 years. I think I can count on one hand the number of people that have actually been evicted from their units. Most people either pass away, in some cases they need a higher level of care, or in some cases they may move out to live with family or friends. So we really work hard on having people not be evicted. And those voucher subsidies I talked about earlier, if someone has an eviction on their record, we have basically doomed them to at least 5 more years of homelessness, because they will be blacklisted and not be eligible for a rental subsidy for at least 5 years. Here's some of our staff working with our clients on the case management and benefits. The health and wellness group, so as I said, it's not always about illness. We try very hard. We're dealing with people who are traumatized and who already feel very bad about their situation. So we try not to always focus on what's wrong with you. Trauma-informed care is not what's wrong with you, but what happened to you. So that is our orientation, is to really try to understand what happened in your life and help you put the pieces back together. So we also do fun things. We have yoga, we have art classes, we have meditation, we have pets who come in. So it's not always just about reminding people that you're homeless, you're mentally ill, you're substance addicted, and gosh, aren't you a loser. It's not about that at all. Individual counseling and therapy, so mental health is a core service of ours, and as I said, we have a very large clinical staff. In addition to our licensed clinicians, we have trainees or a training site, so we usually have 12 to 15 interns that train with us. And are there any mental health professionals in the audience? You've been tortured with your 3,000 hours of, you need 3,000 hours of field supervision to be licensed. This is our colleagues. This is Dr. King. If you've never encountered Dr. King, he has this very unique handlebar mustache, and he's a wonderful human being. I mean, he's just one of the greatest people ever. So you remember Jill, right? That was Jill, and I want you to take a good look at Jill's face here. This is Jill today. So she was homeless for 10 years here in the Palisades. Yeah, give yourselves a round of applause, because you all did that. I mean, it's too bad we can't get a close up here, but look at how being on the street ages someone. It's a completely different person. Completely different. This is a little bit more, and I've already talked about this, so I'm not going to go into detail about this because I want to get to the Q&A. So that's us. We go back to, there we are. I want to talk a little bit about Measure H and HHH, and then we'll have time. How am I doing? Yeah. Sharon knows I'm very chatty. You know, I like to chat, so somebody's got to get the hook here. Let me talk about Measure H and HHH. How many of you are familiar with those initials? Yeah, I'm sure many of you voted for those measures. So let me just quickly describe what they are. The voters in Los Angeles County did something quite historic, actually. In November of last year, in 2016, we passed Measure, those of us who live in the city of Los Angeles, passed Measure HHH, which is essentially will provide money through a parcel tax, a property tax. So those of us that own property in the city of Los Angeles will pay a tax that will go to a fund to build affordable housing. 70% of that money is set aside for housing for homeless people. So it'll be a significant boost to, it's expected to generate about $150 million a year in capital investment. Now, it's not nearly enough. It's a drop in the bucket when you think about 58,000 homeless people. We have a long way to go, but we haven't had a sustainable source of capital investment for a long time. Then in March of this past year, the County of Los Angeles the voters passed Measure H, which is a quarter-cent sales tax, which will be dedicated to services. So in permanent supportive housing, you need both. You need the bricks and mortar, you need the physical space, and you need the services, because that's really the tie that binds. It begins with outreach and engagement, moving into interim housing, mental health care, medical care, all the supportive services that are necessary to engage people and to keep them housed. That will generate about $350 million a year over the next 10 years. That first infusion of money is starting to hit the streets this fall. So